All right. I'm going to give everybody a second to get logged in, and then we will get started on today's wonderful webinar that we have planned for you. As many of you guys know, my name is Ginger Jarek. I'm the Executive Director of Connectionology Seminars of America, and we are thrilled to have you join us today. I wanted to just make a quick announcement to let you guys know that the agenda, everything is live on our website for our Nashville TBI seminar, which is happening May 6th through 9th. We're going back to the West End. We have a lot of amazing speakers that we are bringing in and experts, and we're going to be talking about all about TBI for 4 full days. So we hope that you guys can join us. Also, we are added Hawaii and we have Fort Worth, Texas. Those seminars are coming together very nicely. And we're going to have all those details up on our website soon too. So I hope everybody will come out and meet us and join us for these great events. In addition to that, I'll be rolling out all of our March webinars starting this week. And you're going to see a lot of those that you can sign up for. But today is very special because we're bringing in 2 incredible doctors. We have John Romano, who's back to help moderate with us. And we're going to meet 3 of our incredible partners later on in this webinar with HMR, OnPoint, and Fox AE. We adore these groups, and we hope that you will continue working with them. If you have any questions, be sure to put those in the Q&A box today. We're going to answer them after the webinar. And then at the end, I'm going to share the contact information for everybody involved today, including please forgive me with my incredible mascot that we have with Connectionology. Every now and then he likes to make an appearance and say hello to everybody. And he must be very excited that both of the doctors are with us as well because he said hello. But anyway, guys, I'm sorry about that. Let's get to it. I want to introduce our incredible moderator, John Romano. He's the founder of Romano Law Group in West Palm Beach. And a neat fact about John is that before he became one of America's beloved trial lawyers, he was actually a captain in the United States Marine Corps. And he's board certified. He's gone to trial on just about every single type of civil and criminal case that you can imagine. You guys, that's like well over 300 different trials. And he was also inducted in the Trial Lawyers Hall of Fame in 2016. He's an author. He's one of the most sought after speakers across the country. He's about to complete his 50th state, you guys. We're going to be going to Hawaii. And that is incredible. And I can't wait to do this with him. But in addition to that, he's also been a president of just about every major trial lawyers organization, including the National Trial Lawyers, the Melvin Belli Society, the Southern Trial Lawyers, and the Florida Justice Association. But we all know that at home, John, you're the vice president because our president is actually Nancy Romano. They celebrated their 52nd wedding anniversary just back in September, and they've got 11 beautiful grandchildren. John, we are so proud of you, and we're glad to have you with us today.
Well, thank you, Ginger, and thank you for your tremendous efforts and work on behalf of Connectionology. And I thank Ginger a lot, but remember this, when COVID hit, Ginger immediately hit the ground running in terms of webinars. And there were 3 a week, and now we are coming to over 300 webinars since we got started with the webinars. We were already doing the seminars, and we have some great live events coming up. Please remember, any of you who are listening, if you want to be a speaker and you have a great topic or something to share, you let us know. If you want to do a webinar, you let us know. That's how we all come to do this. We share information, we work together. I am crazy excited about today because today we're going to hear practical, real life, working tactics, strategies, helpful hints on what we need to know, how we need to know it, what we do with it, things that we'll be able to take back to our practices either later this afternoon or tomorrow when it comes to what we will hear from our 2 doctors. Let me start with Dr. Survam Patel, a state licensed board certified pharmacist, serving now as managing partner of Compliant Clients, which is a health service company which improves patient case outcomes through customized medical transport services and pharmacy support. That's just incredible. When I first spoke with the doctor about that. I said, I've never heard of anything like that. And when you have innovation like that, a creative mind putting together something like that and taking it from the conceptual to reality, doing nothing but helping our clients and other patients, that is incredible. He's an advocate for his patients, and it's not uncommon to see Dr. Patel navigating his way through the halls of the Texas Capitol buildings there, speaking, testifying on behalf of different issues, different causes, on those things that are so important in what we are doing in the tort system and system of justice. One of the things about Dr. Patel that has great meaning is this. He is a visionary. A visionary is someone who sees the impossible and makes it happen. And you're going to hear him explain how he is doing that in his practice and how that all relates to what we are doing in our respective practices. We also have with us today Dr. Scott Tauber, the COO and Director of Education for the American Institute of Personal Injury Physicians. He has over 26 years of active clinical and healthcare consulting experience and has served as an expert witness for both plaintiff and the defense side on medical legal cases and issues, and has been an independent medical consultant for several major automobile insurance carriers, healthcare companies, and state regulatory agencies. He is also the developer of the, quote, personal injury success blueprint, end quote, system, which helps providers quickly improve the personal injury portion of their particular practice and work more efficiently with medical legal professionals while maximizing their performance and growth. Who have you ever heard of who does that? That is so extraordinary, so unusual, so unique. Again, that's what we're going to be hearing about today. Dr. Tauber is also a diplomate of the American Board of Chiropractic Orthopedists and a certified professional coder. So it is really an honor and a privilege for us today at Connectionology to bring these two extraordinary gentlemen with their background and their experiences to you today. I will turn the program over to them. Dr. Patel, Dr. Tauber.
Well, thank you very much. I appreciate that, Mr. Romano, and very happy to be here, and thank everybody for taking time out of their busy day. And we're going to go ahead and get started with new ways to avoid case killers in 2023. And you're going to hear from Dr. Patel. He's going to discuss some of these as well. I'm going to cover a couple very specific ones. The purpose of today, really what I want to do is give you an overview and then kind of dial it down to a couple of things that you can take back to your firms that are going to help you to identify potential case killers or case crushers or case destroyers or whatever you want to call them, things that really limit your clients from getting care or access to care, compensation, as well as preventing you from maximizing the recovery as well. So what am I calling case killers without being hyperbolic or being dramatic? Basically, these are issues or situations or actions or sometimes inactions or arguments or disconnects that happen in cases. I'm sure you're very familiar with a lot of these. For example, patient social media, right? That could be considered a case killer. Not going to talk about that today, but you know that that could be an issue. Sometimes cases, they just come with bad facts and you kind of have to deal with those. And all of these are going to impact the claim potential. Some of the others may be providers not understanding personal injury and giving you the right information or the right materials to be able to maximize settlement and prevent your client from getting the care and services that they need. So we're going to focus on just a couple here today in just a minute, but basically these case killers make your firm, your job, a whole lot harder than it has to be. It creates carrier pushback, decreases the opportunity for policy limit settlements, and the bottom line here basically winds up costing you hundreds of thousands and possibly even into seven figures over the course of your law practice and over the time that you're practicing. So what we want to do is identify a couple and then give you some actionable items to overcome them. So I have to ask this question. Have you ever sat down to open up a file, a client's file, after they've been released from care, and you're ready to take a look at it and you're ready to dive in and see what's going on, and three little letters come to mind? You see that over there? Now, you're probably thinking, no, that's what I normally think, but what I want to, I consider these letters wish this file. Instead of what you were probably thinking, it should be wish this file. So have you ever opened up a file and said, well, I wish there were higher level diagnoses in there. I wish this file included some really appropriate and timely co-management. I wish this file had objective biomarkers. That would have been helpful. I wish this file highlighted severity and value drivers. Or just in general, I wish this file made sense to somebody. I know a lot of attorneys and I speak to them, and many of them have this exact response. So if this sounds like you or rings true, then I totally understand. So a lot of times what happens is during the client's initial interview, if they come to you first instead of maybe a healthcare provider, everything looks good, right? There's plenty of coverage. You do what you do your due diligence. There's potentially a nice settlement at the end or on the horizon. You refer them out, and then the file comes back and we've got a little WTF, wish this file, not the same interpretation that you might be thinking originally when you saw this. Now, here are just a few of what I call case killers. Now, I'm sure that you can add to this list, but diagnoses, missing injuries, those are two that I'm going to focus on here today. If you didn't know this already, those two, diagnoses and injuries, are really two of the highest or the biggest value drivers in personal injury cases and working with a third-party software. So when injuries are missed or they're underdiagnosed or poorly diagnosed or misdiagnosed, it can become a problem, becomes problematic for you later on. Treatment compliance is also a case killer. As I'm sure you know, patients having gaps in their care, and Dr. Patel is going to do a great job in going deep on that. But that also leads to communication. Wouldn't it be great if your providers actually were better at communicating that the patient had gaps? And I'm going to show you how you can overcome this very easily here in just a few minutes. Another case killer is not having advanced imaging, or sometimes we'll call medical evidence. As attorneys like to call it, or objective biomarkers. They all kind of mean the same thing, objective findings. Advanced imaging is critical to be able to capture this evidence, to be able to relate it back to the precipitating event. And without it, we have a problem with the case. And then just in general, PI-specific documentation, which is a whole, as I'm sure you know, dealing with providers, I'm one, so I totally understand. This is a whole seminar or a whole presentation in itself, is personal injury specific documentation. We don't have that kind of time here today. But also some of the others that you might want to consider: causation statements, functional loss, basically over-treatment, under documentation. Any or all of these, imagine, I'm sure you've had cases where all of these have been in there. It becomes problematic. MRIs, no MRIs, no MRAs, no DTIs. You have providers that are what I like to call the lone wolf syndrome. They go it alone out there. They're the only treating provider. So I totally understand, that these are all creating a problem for your client, patient, as well as the settlement, and creating it a more difficult opportunity and time to settle your cases for fair value or policy limits, and to maximize the recovery. So we're going to focus in and dial it down here today just on diagnoses and missed injuries. I'm going to show you here a very specific example. So let's give you an actual case example. Let's look at this. Now, it's always helpful when you actually have a case, if it comes with red arrows on there, that's always nice, but not all of them do. But you can focus in on these red arrows over here. What does this mean? This is actually an intake from a patient. Now, it would be nice if this patient had seen the attorney beforehand, but in this particular case, they went to the provider first. So I've highlighted memory loss, headaches, loss of words, which is pretty significant, difficulty sleeping, and irritability. Now, of course, you see other things listed there. You see jaw problems in column number 3. You see some neck pain and neck stiffness, and spinal injuries, back pain, lower back pain, back stiffness. This right here, these 5 symptoms are critical because they're indicative, and I'm sure you know, of a traumatic brain injury. Our patient clients often give this to us on a silver platter. But what happens is somehow it falls through the cracks. So we need to work the attorneys with the providers to make sure that this is getting documented, that it gets into the records, that it gets diagnosed so the client can get the care. These are cases that have tremendous potential when there's a TBI, but unfortunately, sometimes they don't get worked up the way they should. So we can see that this has the 5 symptoms here related to a TBI. Now, let's take a look here in our next slide. This is the actual diagnosis. Now, you're probably very disappointed if you're the attorney on this case, because where are all of the TBI symptoms? You don't see them. We've got all of these segmental dysfunctions. We've got cervical pain. We've got lower back pain. We got thoracic pain. This is significantly underdiagnosed. Now, I won't bore you with all the details, but this particular patient was actually a paralegal that went to a provider. They were referred, and they went to a provider, and they wound up having to get advanced testing, and they had to go beyond this particular provider because this provider wasn't working up the TBI, and they clearly didn't even diagnose it. Most cases, if you're not familiar, most providers will diagnose somewhere in about the range of 4 to 8, where in my experience of working with providers and attorneys, most cases, even relatively simple ones, should be somewhere in the 12, 15, maybe even up to 20 diagnoses. When I looked at this file and looked at what the patient had written down, what the doctor had actually documented, but then ultimately diagnosed, there were literally 10 diagnoses that were missing. Is that killing this case? Absolutely, because this patient is not going to be able to get treatment for their TBI. It's going to make it so much harder. It's going to make it so much harder to settle this case, and it's certainly going to be so much harder for the insurance carrier to understand why this wasn't even in the records. So these are diminishing the recoveries. Diminished recoveries, obviously, no one's happy with that. And this is what we want to try and overcome and give you some actionable items. Just to throw out some fun facts for you on TBI, if you look at the literature, 50 to 70% of motor vehicle crash cases have TBI, some form of TBI in them. In my experience and in my view, that is actually closer to about 80%. The 80% of your cases have some form of TBI. Now, what you want to do is go back and say, okay, if that's true, am I actually getting TBI diagnoses from my providers, or is my staff identifying it and helping the providers, or identifying the TBI so we can get a fair value settlement on this? Just another aside that you may or may not know is that when there's a TBI, that particular condition and set of symptoms typically doesn't fall into the evaluation software. That's kind of settled the old-fashioned way, whereas some of the other injuries go into the evaluation software. And TBI is one of the top 2 missed conditions in all of personal injury. Let's take a look at another one. So I want to draw your eye to the next one. Look at this one. This is a problem for a lot of different reasons. Here's another underdiagnosed or misdiagnosed cases. Now you're probably thinking, Scott, well, what can I do, right? Well, what can I do about this? It's up to the doctor to do this. Well, I'm gonna give you some things that you can do, but I want you to start to train your eye that when you see this, you should know something's going on, and this is really leaving money behind and client not getting care. I put some underlines here, but there's so much going on here. Let's just go to the middle where it says M2551, pain in the right shoulder. Now, as a physician and somebody that works with physicians and attorneys, that's a major problem to settle this case. Why? It basically says that this provider didn't really care, right? You're looking at from a bird's eye view, from a truly objective view. They didn't really care to identify the pain generator. How good of a diagnostician is this provider where a patient comes in and says, you know what, doc, I got pain in my right shoulder after the accident. And then the doctor does what? Diagnoses pain in the right shoulder. Wow, you need to be a great diagnostician for that, right? There's absolutely no indication where in the physical examination, it was a slap lesion, it was a possible rotator cuff tear, it was an impingement syndrome. There's no advanced diagnostics. This is undervaluing, basically killing these cases that potentially have tremendous value. Patient's going to have a hard time getting care for this. They may even, and this may even be your experience, they come back to you and go, okay, I'm all done. The doctor released me. How you doing? I go, I'm doing fantastic, except my shoulder is killing me. And they go, the attorney goes, well, did you tell the doctor? And yeah, I told the doctor. Well, what did they do? They didn't do anything. That's why it's still killing me. And then what happens? You, as the attorney, now have to make what? Medical decisions for your client because it's in their best interest. And I'm sure that's why all of you decided to go to law school, is to graduate and then make medical decisions for your clients. That's the whole purpose of going to law school, right? Of course, I'm being sarcastic, but in the best interest of your client and the case, sometimes you got to do what you got to do, but it's not a good look, is it? It's not a good look to the insurance carrier when the attorney is making medical decisions. It would be great if the providers that you actually worked with could do this for you and basically set it up on a tee, and all you got to do is hit that straight down the fairway 300 yards and all day, every day. So this is what's going on out there, and I'm sure you've seen this, but what can you do about it? That's the next few steps here. So when you couple misdiagnoses, underdiagnoses, injuries that are missed, now you start to couple that with files that don't have missed objective biomarkers or redundant care. I'm sure you've all seen redundant care where the doctor's doing the same thing over and over again, expecting a different result. And we know the definition of that. Unreasonable bills, poor case management, treatment notes issues with all kinds of canned or redundancies or cloning or any of those issues. You couple that, and it really hampers your ability to compensate your client and to maximize the recovery. And again, bringing it all back, it's killing your cases. It's absolutely killing your cases. You're working for pennies on the dollar when these cases have a tremendous potential recovery if they are evaluated and managed and worked up correctly. And I'm not talking about, finding things that are not in the records. This is not about embellishing or doing anything like that. This is basically things that are there that are just not getting identified. I want to share something with you. This is what I like to call the best well-known secret, is that the providers that you're working with I don't care if they're a physical therapist, a chiropractor, an ortho, a neuro, pain management, neurosurgeon. I don't care who they are. Guess what? We did not learn personal injury in professional school. How about that? I mean, absorb that for a second. We see PI patients. We want PI patients. We want to work with you. We want your referrals and we want to refer our patients to you, but we didn't even learn it. How are we supposed to manage and work in the med legal arena? Now, you'll run across a doctor or two said, yeah, I learned some PI in my professional school. But if they're out more than 3 or 4 years, that information is antiquated. It's no longer useful. PI is constantly changing. So if we didn't learn it, and as you can see there, and we don't keep up with PI regularly, and we're not sure what to look for and what we need to give to you, then how do you work with us? Right? It makes it very difficult. And so what we're trying to do is avoid that big disconnect between the med legal professionals, the attorneys, and the providers to make everybody a win-win, the client, patient, and everyone. But you already knew, if you've been doing PI for any length of time, you just have to look at your own files. You know that a lot of the providers that you're working with don't really know personal injury. They're great at what they do. Don't get me wrong. They're great at treatment. They're great at getting patients better. But when it comes to this specific part of their practice, it's really lacking. This is another thing that you should know. PI is a very small part of many providers' practices. And again, being sarcastic, we all know that the less you do of something, the better you are at it. You don't have to look any further than my golf game for that. And so if they don't do a lot of PI, it makes it very difficult, which leads to their practices not being systemized for personal injury. They focus mainly on treatment and they don't see the big picture. They don't think like you think. And so it takes a lot of training and a lot of postgraduate training and a lot of effort for doctors to actually want to get out there and learn this. But of course, you already knew that as well, that PI is not necessarily a big part of many of the providers that you work with. All right. So what can you do about all of this? This is all great, Scott. We're having problems with our cases. Tell me what I can do. Well, first of all, I highly recommend that you may already have some systems in place. And if you do, I would suggest you go back and dial it down so you do not miss some of these critical injuries. Whether they come to you first or they go to the provider first, ultimately, you're going to get a list of symptoms and injuries and issues that your client patient has. Create some systems in place. And what's even better for your team is to create checklists or algorithms. Even veteran paralegals or veteran attorneys can miss things. Having a checklist, I'm very big on checklists with my clients. Having a checklist so you don't have to remember in the course of your busy day, or an algorithm, if this happens, you do this. If this happens, you go here or here. This will help you. So create what works for your practice. If you have them already, fantastic. Take a closer look at them, especially if you're missing some of these things that we discussed here. Obviously, train your team, work with them to be able to identify these injuries. I can tell you there's plenty of firms that are still missing the TBI, even though it's right there. Communicate with the providers that you work with and educate the providers as well. Now, I know that you're probably going, Scott, I don't want to educate. I don't want to talk to doctors about being a doctor. I get it, because they tell me on the other side, you know what? I spoke to that attorney and I asked them if there's anything I can do better, and they never tell me anything. Well, don't be afraid to work with your providers and educate them. They will actually appreciate it. It's going to be a win-win for everybody involved. Your client's actually going to get care, and it's going to create greater profitability. So if you can get proactive, create some systems or checklists, work with your team and communicate with the providers, and then consider educating them, that will make all of this so much easier for you. So when it comes to team training, here are a few things. You might want to jot these down. The earlier, the better. This is what I suggest. This is how I do it, is identify these opportunities early. You already know that the earlier that you can get involved, whether it's a gap in care to eliminate it, whether it's a diagnosis that needs to be worked up a little bit more, whether it's an injury that needs some co-management, the earlier the better. Once the case is over and you're looking at that file and those 3 letters come to mind, it's so much harder. Well, how do we do that? That goes back to systems. Create a system to gather some records. Gather the patient's records. I know it's not easy to get records from providers on a timely basis, but there are certain key visits within each case that you want to have to look, your staff or yourself, to look at to make sure that things are getting done. This is part about being proactive. If you're going to be reactive and not do that, then not much is going to change. But if you can identify these early on, have the systems in place. If they come to you early, have the right forms to capture that. Once they get out to providers, key times to gather these records. When you get the records, you kind of have to know what to look for. You have to decipher. And I know that, the reading doctor's notes, and especially in today's environment with EMR and, hundreds of pages, and they all look the same. It's great to, for insomnia. So any insomniacs out there, all you need to do is open up a patient file, and I guarantee in 5 minutes, your insomnia is cured. But you need to know what to look for in the patient notes. You need to look for the injuries. You need to look for the symptoms that could then go into more objective findings that would then be a higher level diagnosis that would then increase the case value. You have to monitor the case management. You have to stay on top of the provider. So many attorneys come to me and say, Scott, can you help me? I've got X amount of dollars in bills, or I've got a year and a half in treatment, and what can I do? You can't do anything at that point. I mean, you got $60,000 in chiropractic bills, or you got a year and a half of treatment, and probably a year of it is with no improvement or plateau. How do you justify that? So you have to stay on top of your providers and communicate with them. This is all going to create a lot stronger case for you. And I keep coming back to it, but your clients are going to be happier. They're going to get the care and management and treatment and compensation that they deserve. And you're going to be a lot happier too, because you're going to actually be working with providers and training them and understanding what it is that you need to help you out. And they're open to it. I kind of feel like sometimes attorneys I don't want to step on any toes. It's okay. You can step on toes. You can tell them Dr. Tauber said it's okay. So this is something that you could use in your office. You may have something like this. We just call this create your resources. This is one of several checklists that we use. And when your client comes in, this is for TBI specifically. There should be absolutely no reason, no chance for a TBI to be missed ever in your office again. If you use something like this, where you already know, I'm sure, that TBI has multiple categories. Your client fills this out, or your paralegal, or you could go through this with the client at the time and check off the different symptoms under physical, emotional. There's also behavioral. This is, again, a resource that we use. You can include immediate co-management here. You can include things like treatment. You can include diagnoses, making sure that the providers are using the right diagnoses. Create this as well as some of the other resources to help you. And this is very easy to make sure that you're not going to miss any TBI and limit your cases or your potential recovery. So diagnostic imaging, I mentioned, objective findings, treatments, all of that should be on that particular form. Now, is all this going to be worthwhile? I don't know. You need to decide for yourself, but take a look at this. This comes right off of a website. All of these are related to TBIs. Pretty nice settlements, right? But you and I know that the first thing, and I'll let you in on a little secret. You and I know this already, that in order to make a claim or to put it into your demand package, it has to be where? It has to be in the treatment records. It has to be in the documentation. It has to be in the records. Guess what? Providers don't know that. That's a dirty little secret that you can share with your providers. Go, hey, do me a favor, put it in the records. I've actually had doctors say, you know what? I don't want to put a TBI, mention TBI in the treatment record. They said that to me. You know why? Because they don't want to be responsible for it. It's like, are you kidding? You're already responsible for it if the patient told you about it. You can't ignore it. But that's the mindset that's out there sometimes, that if you can work with that and be proactive and work with your providers and educate them, that's what you're up against. And that's what's limiting you from getting these fair value or these maximum recoveries. And they're killing your cases every day, all day. And you already know that. But it will be worthwhile if you can create these systems for yourself. And I mentioned, educating providers. Sure. Is that something that you want to do? I realize not. But providers don't know about med-legal disconnects. They don't know about the importance of causation. They don't know about relating the accident back to the findings back to the actual injury. They don't know about creating that opening statement that states that, the patient is seen for follow-up of injuries, related to a motor vehicle every single office visit. They don't even think about that. As a provider, I'll share with you, why do I need to put in a causation statement? For me, as a healthcare provider, Mrs. Jones didn't have her symptoms yesterday, and now she does. Boom. It's so obvious. They don't even realize that they have to put that in formally. So if you want causation statements, tell your doctors to put in causation statements. Tell them how to do it. Tell them the magic language. Tell them what to do. Tell them the process. It'll make your cases easier. Talk to them about fundamental PI arguments. They don't understand arguments. They do what they do, and they're killing your cases. They got blinders on for treatment. They treat the patient, they send the file to you, and they run to the mailbox every day after that, hoping that there's a big check in there at some point. And they don't realize that what they're doing now has to be argued by you. Well, now if you know that, help them out. Supply some basic resources for them and appreciate that they're limited in their med legal knowledge, and none of us learn personal injury. And the only way to do it is to do it postgraduately and to actively seek this out. Just I'll end this because it kind of ties into Dr. Patel. This is something that we provide our clients, and it's just a simple algorithm for patient rescheduling. This helps our clients eliminate gaps in care, which is going to lead into Dr. Patel's presentation, which is a huge case killer. As you know, multiple gaps in a plan of care really, create problems. But as a provider, it's like, okay, well, how many times do I call the patient? When do I contact the attorney? How many times, or how long should I wait? Is a month too long? I actually spoke to a provider a couple of weeks ago and said, yeah, I haven't seen the patient in a month. And I finally called the attorney. It's like, okay, well, that's probably a little bit too long. But so help your providers out, help your paralegals, help yourself out, help your clients out, create this win-win-win, and you're going to avoid these case killers all day. And so that's my presentation. I hope you enjoyed it. If you have any questions, let me know. I'm going to turn it over back to, I think, Dr. Patel or Mr. Romano.
Wow. I mean, that was just tremendous. I can't thank you enough for that. And I'm looking forward to see where we end up as the questions start flowing in and we go into our question and answer part. But for right now, let me turn it back over to Ginger. You all set?
Absolutely, you guys. And what we'll do is we'll go ahead and just take a quick break right now because I want to bring in Dawn with OnPoint Legal Nurse Consulting. And we're so happy to have her back today because she's going to share with everybody all the great things that they do over there. And in the meantime, I've seen some amazing questions rolling in. We're going to take the questions at the very end after we finish with Dr. Patel's portion of his presentation, but these are really good. We're going to make sure that we get to all of them. And Dr. Tauber, you're amazing. Thank you so much for presenting on that.
No, thank you for
I already
allowing me
have
to
everyone
present to the
asking
group.
for all of your checklist, so we'll make sure we get that to everybody after the webinar. But Dawn, thank you for being here with us. If you don't mind, share with us a little bit about what you guys do. I mean, we are so honored to work with your company. You got amazing people over there, and it's an honor to have you.
Well, it's been a long time, Ginger, so it's nice to be back and happy to be here with you. If you've been on before, you may have met me before. I work for OnPoint Legal Nursing, and I'm the director for the Expert Witness Location Program. And we're actually divided into 3 arms. We have the long-term care and geriatric program that Ingrid manages. Lisa Mancuso manages our consult program. And I, of course, do the experts. And usually I love to talk about expert location because I really enjoy it. I enjoy listening to you talk about the details of your case. So sometimes, attorneys call and they ask me for one type of expert. And after some discussion, we say, you know what, you might get more bang for your buck going with a different type. So, I don't always give you what you ask for. I give you what you want. And we come to that conclusion together. And, I have a big database of experts, but sometimes people have somebody with very specific credentials they want matched or a very particular procedure. So if I don't have somebody that meets that, I don't send you the next best thing. I will do a national search to find exactly what you need for that case. But today, after listening to Scott, I'm so excited that I feel like Lisa should really be here talking about the consult program, because so much of what our consult program does is really relevant to everything that Scott talked about. He was talking about having systems in place, and we actually have some firms where their system is that every case comes to us and gets a chronology done by a nurse. And that is so helpful. Paralegals do a great job, but they're not nurses. And a lot of our nurses have 20, 30. Some of us are getting up towards 40 years of nursing experience now. And having a nurse with a lot of critical care experience going through and doing your chronology is completely different than having a paralegal or an offshore chronology done. And when we do a chronology, we're going to be able to identify when did your client complain about neck pain? When were they treated for it? How were they treated? And we're going to include the date, who the provider was, a page number. So if you want to go and reference it, or if your expert needs to reference it, it's very simple. And then we put a column that you can exclude if you'd like, if you're sending the timeline and chronology out to an expert, but it's in there for you. And that's going to include our comments, and we'll tell you, well, this is what this means. This can be indicative of this, and this is why you would order this test, or maybe they should have ordered a different study that wasn't ordered. So really help you to understand and interpret, because another thing Scott mentioned was deciphering things. And, you attorneys do so much research and you know so much about so many medical conditions, but do you really want to research every single lab value or complaint? Or is it easier to have a nurse that can kind of sort that out and decipher all those notes for you? So we can really help you in that regard. He also mentioned gathering records. We actually can get your records for you, and nurses will go through and organize them, OCR, and index them for you, and identify records that are missing. So when you get a chart, it oftentimes is not complete, and we can really help you with that. Some of our firms that use us routinely for chronologies, the one firm does a bill review on every single case as well. And we have certified coders that can go through and they'll tell you what's usual and customary, and they can include geographic modifiers and really make sense of what all those bills mean, and what should be getting paid and who should be paying it. Sometimes they'll do pain and suffering reports. I know John really likes to talk about our pain and suffering reports, and it's a great way to really paint a visceral picture of what it's like to go through what your client went through. What's it mean to get a wound debrided? That sounds so clean and sterile. Well, when you talk about, kind of like, peeling off layers of skin, I mean, it's uncomfortable. And listing pain charts where people are complaining of pain at a 9 out of 10, and they had 72 wound debridements over, a few month period of time where they were hospitalized. It paints a really graphic picture, and it's great for settlement purposes. That can be useful. And another thing that they'll do intermittently is medical cost projections. And a lot of you are very familiar with life care plans, and they are wonderful for traumatic, catastrophic cases. But sometimes when you have a case and you think, well, it's a smaller case value, you really don't want to invest, 40 hours for a life care plan. But a cost projection uses a life care planner who does not need to go through a record in its entirety. They can work from treating or examining physician reports, so a couple of pages, and put together a whole cost projection that might only take them 5 to 6 hours, and you might get $80,000 or $100,000 more case value. So lots of behind the scenes things, expert things that we can do to really help you achieve all the things that Scott was talking about today with gathering, deciphering, having systems in place. And we really try to support your team, make your life simpler, and manage the case from behind the scenes, facilitate your communications with experts, and set up appointments as needed. So we'd be happy to talk with you. We'd love the opportunity to work together with you. And Ginger usually asks me to post my contact info at the end, so I will do that, and I'd love the opportunity to chat with you.
That was terrific. And again, my thanks to OnPoint for being so supportive and so strongly behind us through all these years, the way you have supported Connectionology. But as you were talking, I want to make the point to everyone, lawyers and paralegals cannot do what a nurse does when reviewing and assessing records. Let me tell you how ridiculous it is when I hear a lawyer say, I know records better than doctors themselves, or I have a paralegal who knows more about That's like me saying, I know more about birth than my wife. I think everybody I know would just start laughing. They'd probably start kicking me. How absurd can that be? We don't. A nurse is trained for years and then has years of experience where that's all they are doing. A lawyer and paralegal, we're doing 50 other things. And oh, by the way, we also happen to review medical records. I want a nurse reviewing and assessing and evaluating medical records. I want a nurse involved in conducting interviews of our client. A nursing interview is different from an initial client interview by a lawyer. I want them to do a pain and suffering report, which simply is a game changer when you go into a mediation. So I could go on, but we work with OnPoint because they take a case to a different place, to a different level. More importantly, they take us out of the mindset as a lawyer or paralegal of thinking we got all this under control, and they go, no, you don't have it quite under control, but let me help you get it under control. And that's what they do. So get legal nurse consultants involved in your cases, all of your cases. And obviously we just love working with OnPoint. Dawn, you all have just been fabulous. You're skilled, you're talented, you're responsive, and that's a big thing. So thank you again and again to OnPoint.
We appreciate it. Thank you, John.
Yes, I'm happy you're here with us today, Dawn. And you were right. If you could post your information in the chat box so everybody can stay in touch with you, that would be great. And we hope we see you back here again soon.
Yep. Thanks, Ginger.
You're welcome. And now I see that Cody is with us, who I just saw last week at a convention. We're so happy you're here with us, Cody. You're going to wow us today, aren't you?
I hope so. But first, I just want to say I'm excited about Nashville. So I'm going to see you again in Nashville, and hopefully everybody here in Nashville will be passing out cowboy hats for the party. So, but yeah, we do. And thanks for the intro, Ginger. We do graphics. So it was said just a little while ago, going through the medical records, that's a great way to fall asleep, right? That's what you hear. And so what we do is we take those medical graphics or medical records and bring them to life. And so we're with Fox AE, and we do TBI, brain demonstrative. So I had to add a carbon monoxide intoxication here. Can you guys see that? Is that coming through?
Hold on a minute, Cody.
Yeah.
What is that
That is
Software, what is the software by which you are doing this? Because you just blew me away. How are you doing that?
it's magic. It's called Prezi.
Spell Prezi.
Prezi.
All right, I'm not going to interrupt you again, but that was tremendous. Keep going.
Yeah. So I was hoping that, like, for a deposition, people could use these in depositions, John, but I didn't want to bring that up. I could talk to you about that later, but wouldn't that be great if you're trying to talk this through as an expert witness, and then this stuff pulls up and you can point and say, well, here is a white matter lesion up at the top and enlarged ventricles, the globus pallidus necrosis, and hippocampus atrophy. So all of these, I just saw that one of those medical records had carbon monoxide poisoning, and we can bring that to life. And then the last thing we can do is a lot of different things, but this volumetric reconstruction, we can do that with TBI. We can do this with bones. And here is one where there is a burst compression and it caused paralysis here. And we're able to show how that cuts off the spinal cord and compress the spinal cord. And so we zoom in, and so that's not an illustration of the spinal burst compression. That is the spinal burst compression. And so then you zoom back out and you can get a sagittal view, and then you can see exactly where it was cut off and where, paralyzation begins. And then we zoom out, just in case you don't know if it's accurate. Then we transition to the sagittal view with the medical record. So a way to bring it to life and really communicate maybe hard to understand stuff. That's what we love to do. And so we love Connectionology, and thanks for letting us be a part of it.
Cody, my thanks to you and your team and your wife, Vicki, for the way you are supporting Connectionology. But I must tell you this, the thing that jumps out at me, you're very skilled, talented, smart, you're an engineer, but it's your enthusiasm that has struck a wonderful chord with me, with my wife, with everybody we know. And it's like every time I see you, you have something new, creative, and innovative. But I want to let everybody know we're working with you because the quality of what you are doing in the product you provide to us, it is enhancing our cases. And that's whether it's an engineering animation, like you did for a building collapse case that we've got, or a medical animation, medical illustrations, and even more recently, the way you and your team molded an entire series of slides for us, which we can use in a lecture presentation or in an opening statement or in the direct or cross of witnesses. It's incredible. So they're doing all of these things magnificently, but with a level of enthusiasm that I just think is extraordinary. And one of the things that I can truly tell you brings joy to my heart, it's when I see adults who have the enthusiasm of a 10-year-old child. I just love to see that. And you and your wife, Vicki, have that, and you're an inspiration to all of us. So thank you.
Well, it's hard not to be enthusiastic when you're working with Ginger and John. That's all I have to say. Thank you so much, guys.
All right, and I can't stop smiling. Thank you so much, Cody. Don't forget to drop your information in the chat box as well. Can't wait to see you soon again in Nashville. Again, I hope everybody will join us for that. But now we're going to switch over to a great presentation by Dr. Patel. And then later, maybe like 20, 25 minutes, I'm going to bring in Richard from HMR. And then we'll do our special coffee giveaway at the end, and we'll answer all of your questions. But thank you again to our amazing partners. And thank you to everybody watching for giving everyone a great shout out and just listening to our great partners and what they do. So thank you guys. Let's get back to it.
Okay, let's start by sharing the screen. Let me know. Do you guys see that okay?
Yep, that's great.
All right. So today we're going to be talking about, again, going on or speaking on behalf of John Romano. What he was talking to you guys was, without saying it, was working smarter and not harder. Whether it's working with Dawn and nurse consultants to have them help you with analyzing medical records, that's not anyone in the law firm's forte. Neither is creating graphic visuals to describe an injury, right? That's why you can use a company like Cody's. And what Dr. Tauber was talking about was also, how can you help the medical providers that are in your network be better with helping your clients on their road to recovery? And it all sticks with the same thing. It's working smarter and not harder. And in this age, it's like we're all having to do more with less. Our responsibilities are piling up year after year, and more is being asked of us, no matter what your profession is. And we just have less help, less time to do it. So why don't we all try and focus on working smarter and not harder? And so this presentation is going to cover just 2 ways that we can work smarter and not harder, whether you're a personal injury, you're working at a personal injury law firm, or if you're actually a personal injury healthcare provider. So the advice that I'm going to give can help everyone. And to that end, helping improve case outcomes, it starts at the very, very beginning. It starts with preventing gaps in treatment. It's because it doesn't matter if you have a commercial case. It doesn't matter if you have clear liability, 20 witnesses seeing the accident, and it's a huge TBI case. If you have gaps in your treatment, starting from the beginning, your case value is going to go down. You're going to have problems. So it all starts at the very beginning. And my 2 pieces of advice are going to help you prevent gaps in treatment at the very beginning of your case. What it boils down to is this. It is, you need to just confirm access to transportation and pharmacy coverage. If you can literally make sure your clients have access to reliable transportation so they can get to and from their medical appointments, and if the doctor writes them a prescription, then they have means to afford getting that prescription, and they're going to be compliant with the prescribed medication regimen. That's half the battle right there. That both of those things prevent gaps in treatment. We all know there's so much in a case that's outside of our control. For policy limits, within your control? No. Was liability within your control? Not really. And having, the client's personality, how serious they take this case, that's not within your control either. So the few things that are actually within your control, you want to make sure you have a great handle on it and are able to address it to help you make sure that you help your client get the justice and compensation that they deserve. So before I even go into giving you some advice, I feel like I should provide some credibility here. I've been in the personal injury space for about 4 years now, 4 going on 5. I'm a pharmacist by trade. I'm a doctor of pharmacy. I don't really meet too many pharmacists in this field, and I'm happy and lucky to be one of the few that are getting involved in personal injury to help out. So I am the managing partner of Compliant Clients. We provide transportation and pharmacy on lien. I'm also part of MediMental Care. I believe some of you may have heard Dr. Chris Parker speak on previous connectionology conferences where we focus on traumatic brain injury and other traumatic stress injuries. But my focus, even getting into personal injury, was how can I help? Because the top 3 trusted professions in the US, nurses are up there with me, our pharmacists are up there as well. When you go to the pharmacy, you will implicitly trust the pharmacist's advice, like, hey, what do I take? What over-the-counter medication is good for me? And I wanted to help more than just the patients that were at the pharmacies that I own and manage. And a couple of personal injury attorneys in my area, I live in Austin, Texas, some personal injury attorneys came to me and they were asking me back in 2018, hey, can you help me with some of my patients' prescription medications? They just can't afford it. And can we use your pharmacy and we'll pay you back whenever the case settles. Letter of protection and lien mean nothing to me. In 2018, I was very green. I wish I met Dr. Tauber in 2018. He could have taught me a lot back then. But that's how I got in, just being in personal injury. And over time, I went back to all these attorneys I was working with on the pharmacy side. And I was like, hey, like, what else can I help you with? And they were asking things that John Romano has already touched on. They were asking for things on like, hey, like, do you have somebody to help with medical records? Do you have somebody to, help with neurosurgery? Or, hey, I cannot for the life of me find a neurologist in so-and-so area. And hey, this client doesn't have a ride to the doctor's office. Can you help? That one struck a chord. That one, I was like, what do you mean they don't have a ride? And they told me, they're like, hey, not all clients have transportation after they get into a car accident. And so I started helping out, giving transportation to clients that needed a ride. And I asked the attorneys, like, hey, can I just bill this like under a lien, under a letter of protection? Like, will that be okay? And they're like, I don't know. We've never done that before. We've always just been paying for it out of pocket, and it's a case expense. And they're like, sometimes we probably shouldn't even be paying for it, because it's kind of like you're advancing funds to your client. And I was like, well, I don't know anything about your field, but let me know if I can do it, and I'll see if I can figure something out and help you and your client out. So back in 2018, I actually gave a couple of rides myself. When I just couldn't find a Lyft or an Uber or another company to give rides, I was the one picking up some patients, dropping them off to appointments, and just telling the attorney, like, hey, I can do this under a letter of protection just like I do pharmacy. And they were like, oh my God, this is so helpful. Like, you should really kind of focus in on this. And without spoiling the rest of the presentation, I just wanted to give you a little tidbit about my background. So I'm a pharmacist by trade. I do a lot of personal injury now. At this point, we have, I think, almost 3,000 cases that we've been lucky enough to help benefit clients on their road to recovery.
And Dr.
So,
Patel, sorry to interrupt
yeah.
real quick, but I did notice the slides are a little bit blurry.
Oh,
Do
sure.
you
Is it a
think
little
maybe we
blurry?
should?
Yeah, let me see. Hold on.
We could maybe close out and open it back up. Oh, it's much better now.
Is it
Yeah.
better? Is it still big, by the way? Is it still big?
I think I can read it. Is everyone watching? Can you guys see that okay?
Yeah.
That's much better.
Okay, I'm sorry about that.
No, perfect.
Okay.
Thanks, guys.
No worries.
And thank you everybody watching.
Of course. So this is not rocket science, right? If clients are missing appointments, the defense knows that. The defense knows that, hey, that's an easy argument to make. They can argue, hey, they're not that injured. They didn't even need to go to the doctor. They missed all these appointments. Everyone knows if clients miss the appointments, you're going to probably have to expect low settlement offers. And that's even if you guys find out they're missing appointments and then they go resume their treatment later on, the damage is usually done. It's not saying it's like final, but it's better if you're able to identify the clients who are missing appointments. And a lot of attorneys ask me, it's like, hey, how long are patients, I'm sorry, I don't know why that's not loading, how many patients are missing their medical appointments due to transportation? Apparently it's quite a bit, about 3.6 million Americans, and that's only from 2 years ago. So it's gone up since then. And traffic fatalities, they just are going up. They're much more common in low-income neighborhoods, and there's like multiple reasons. And there could be socioeconomic differences in vehicle quality, road conditions, substance abuse, availability of crosswalks. There's so many different reasons why the increase in traffic deaths per capita are going up. And more recently, essential workers who maybe couldn't stay home and work remotely, they are disproportionately made up by lower income demographics. And I'm sure we can all agree that over the past couple of years, it's been challenging for everybody. Stress, anxiety, they've all equated to aggressive driving. Alcohol and drug abuse has increased due to COVID, and the US DOT, Department of Transportation, they said that they reported that a proportion of drivers testing positive for opioids had actually nearly doubled after mid-March 2020. And if you guys remember, scratching your heads, that's around when all the COVID shutdowns occurred. And that was compared to the previous 6 months, while marijuana prevalence increased about 50%. And again, that around mid-March is when the major COVID mitigations had begun. And from a clinical perspective, this is pretty important because attrition. And if you don't know what the word attrition, it's literally, I can explain it in layman's terms. If one patient misses a medical appointment to any provider, they are already, actually, if they don't even miss any appointment, they're already 19% likely to miss the next appointment, even if they didn't miss anything. If they missed one or more appointments, that jumps up to 31.7%. So this is really important, especially in the beginning of cases, to really make sure that you get or you are able to help get your clients to medical treatment and make sure there's no delay. And again, many millions of Americans, 6 million Americans are missing medical care due to lack of transportation. These next couple of slides, they're more targeted to personal injury. It's not always because you don't have a ride. Sometimes they have a second car at home, but the other family member may need it to go to and from work, or for transporting kids or something more. Or maybe because they got so injured that they can't, and they have a second car at home, they just can't even drive that car because of the nature of their injury. Or maybe because of financial hardship, it's falling lower on their priority list to get to and from medical appointments. Or maybe the ride or the distance of the ride to the clinic is too far for them to do. And that happens a lot when patients like live in the sticks. And not all patients are getting into accidents in metropolitan areas. Some other reasons are, depending on where you are in the United States, lack of public transportation is a huge problem. I live in Texas, and public transportation is severely lacking. It's not like New York, it's not like Chicago, where there's just a lot of different options to get to and from areas. It's like if you're here in Texas, and even if you're assuming you're just not even in a metropolitan area, it doesn't even matter if you're in a metropolitan area, but if you're not in a metropolitan area, you don't have a car, you're SOL. So it's really a big deal for patients that live in Texas, California, Georgia, and all over. And of course, what if you need a special type of ride? What if you need wheelchair accessible transportation due to the nature of your injury? So these are all just a list of like the highest ranking reasons that we've seen in the past 5 years as to why patients have needed, and law firms have needed, non-recourse transportation. And then sometimes attorneys ask like, hey, like, are there any formal studies on this? No, I tried looking. That would of course help raise awareness, but just doing a simple Google search and the fact that we've already done 2,000 going on 3,000 cases, it proves necessity. I mean, there's lots of law firms posting on their own personal blogs. That's what this Google little screenshot shows. That's informing patients like, hey, it's very important that you make it to your medical appointments and not miss them. And missed appointments are very common. This, you can just skim through it. A lot of these things, it's not really on you to do. It's really on the healthcare provider to do. This is honestly a stream more suited for doctors, because a lot of times people are missing appointments not because of a ride. There's just so many different reasons that somebody could be missing an appointment. And here are some no-show tactics that healthcare providers can do. Some of them law firms could do. Again, I'll be sending some of the slides out, so that, no need to screenshot unless you want to. You'll get a copy of this afterwards. And outside of thinking about case value, obviously case value is important to the patient as well as law firms and healthcare providers, but you got to look at this from a clinical perspective. It's not just about patient attrition. They're just not going to show up to the next appointment. Transportation has a huge role in healthcare access, because when patients have transportation, they're able to get timely medical care, they're able to get treatments they need, they're able to get the medication refills, and it all translates into improved health outcomes. You probably already knew this, but it's nice to see a nice visual of it. And here again, as a reinforcement, transportation has a huge role, and it's just now, coming more to light. This, I'm not sure how many people know this. I know this just because this is my field. Of course, inflation is a pretty big thing, but most people don't know how much drug prices are outpacing inflation. Drug prices are going up every year, no matter what. Even for penicillin and amoxicillin, the stuff that's been generic for decades now, it goes up every single year. Just since 2014, drug prices have increased 35%. So what does this mean? Because there's a lot of a lot of Americans that have prescription insurance. You might be thinking, hey, this is not really a problem. Most of them, I've never had to use personal injury, or a non-recourse type pharmacy solution, because all my patients, they have insurance. True, that is very true. That's what we're seeing as well. Most of the patients we deal with or that we take care of, they have insurance. You might find that surprising. It's because they're struggling to pay for the cost of the medication, even with having insurance. Case in point, let's talk about me, for example. I'm on a cholesterol medication. I have to take it once a month. My doctor, I'm a cardiologist, he was like, hey, do you want to take Lipitor? And I was like, no. And he's like, you want to take Crestor? I was like, no. And he's like, why not? And I told him, as a pharmacist, I know how big patient compliance is. If you're not compliant with your medication, it's just not going to work well for you. So I asked the doctor, I was like, hey, is there anything else that you could prescribe to me that would help with my cholesterol that I just don't have to take that off of? And he's like, yeah, there's this other drug, it's called Repatha. You take it once a month, but it's a little bit more expensive. And I was like, oh, don't worry about it. I got PPO insurance. I pay an arm and a leg every single month for my family to take care of it. We're good. We're covered. He's like, are you sure? I was like, trust me. I'm a pharmacist. I know what I'm talking about. I did not know what I was talking about whatsoever. When I got the copay was like $100-something. I was like, oh my God, what? I can't even curse because it's being recorded, but what the heck is the point of insurance if I'm going to be charged $100-something? And that's me, a pharmacist who owns pharmacies. I would say I'm doing just fine. I can afford it. But what about everyone else who gets, medications, generic or not, and these copays or deductibles or out-of-pocket expenses or donut holes that they're in are just so frequent and they're adding up. And so I wanted to do a little bit more research on this. Again, this a couple of years ago, I found some good studies on this saying that, listen, like 1/3 of Americans have skipped filling a prescription med because of the cost. And that's with insurance. This study doesn't really have this, but a lot of times it's with insurance. So even though you have patients who have insurance, you might want to ask them, like, hey, can you afford your medications? If they don't have insurance, of course, you might want to think of non-recourse pharmacies. But if they do, still ask them, because there's things that they just went through a traumatic event that may have changed a lot of aspects of their lives. And money might be tight, or priorities might be a little different, or maybe they're just not taking it pretty seriously, and they need to be on their medications, assuming they need them, of course. 36% have said the amount they pay for has gone up the past year. That is true. My medication, when I tell you, is $100 now. When I took it 3-4 years ago, it was around $50. The same medication I've been on year after year just goes up year after year. 42% have said paying for meds have been somewhat difficult. Now, you might be thinking, Dr. Patel, that's a brand name drug, I'm sure you're taking. That's why it's expensive. But most patients who have, get into injuries, they're just on cheap generics, which is very true. They're on cheap generics. Here we go. Flexeril. Flexeril is a cheap generic. It's a muscle relaxer. It's prescribed on many, many cases, non-controlled medication. On GoodRx, I know it might look a little blurry. It's around, $9 to $10, $11 for a 30-day supply. There's nothing, outrageous about that there. Here's a mid-range one. This is dronabinol. We've been seeing it prescribed a little bit more. It's usually used in cancer patients for nausea, but also can be used in pain patients to treat pain, as well as for, nausea that's occurring when they're on opioids or other medications that they're just not responding well to and they need something else. And again, this gets a little bit more expensive. A lot of times it's not even covered. The latest trend that we've been seeing is Botox. Botox is a neuromuscular blocker. In 2010, the FDA approved it for chronic migraine headaches. I'm sure you guys all know what Botox is used for outside of this. It is crazy expensive, and insurance does not pick up the tab here. So it really depends on what type of medications your patients are on. But again, like Mr. Romano was referring to in the beginning, you shouldn't have to be the one to figure out pharmacy pricing. If I, a pharmacist, am struggling with it and I own multiple pharmacies, I can guarantee you it's not something you should care to keep up with. Just try and make sure that you just ask your clients. If they need help, they can turn to you, and you know where the help can be found. And you're not directing medical care now. You're just being a great law firm. You're being a great healthcare provider, and you're just trying to give your patient help if they need it. So we know, or at least law firms know, insurance adjustment software might be the bane of their existence. It might be like one of your biggest pain points when you have this great case and you're talking to an insurance adjuster on the other side, and it's like you might as well be talking to ChatGPT, right? You might be talking to a robot at this point, because they're just saying what this software is saying. And these are just different softwares, and I'm sure there's more. You guys are the experts on this, not me. But we know that this software was built by defense, and it takes some factors into consideration. Gaps in treatment is one, duration of treatment's another, and there's lots of other value drivers. But what are the things that they don't take into consideration? Lots of things. That's the things that you guys are fighting for. That's what you're trying to prove, that like, hey, your Colossus software, which arbitrarily designated this case to have this value, it's not enough. And here is why. And these are just an example of the types of factors that are not taken into consideration. yes, and I get it. It's your job or you're trying to prove a point here. But again, these are also just things going way back into the beginning of my presentation, things that are outside your control. You can't control how insurance adjustment software works, right? They're not going to change the algorithm for you to be like, oh my God, Mr. Romano, you're right. Your client is experiencing emotional stress and trauma from having their severe spinal cord injury. We're going to go update the algorithm in Colossus and it will compensate you for it. No problem. Thank you for bringing that to my attention. Said no one ever. They're going to take into factors like this. I just went back 2 slides. So if that is in your control, it is behoove you to try and make sure you do your best to take these factors into consideration when you're helping your clients on the road to recovery. So I already talked about this. I kind of skipped ahead. This is in control. Documenting pain and suffering, preventing gaps and delays in treatment. Yeah, there's other factors here, but these are the 2 that at least I'm focusing on. So without pharmacy or transportation support, let's go through a sample case study. You have a client, today is February 28th, a client who's injured today. They get into a car accident and today's Tuesday, the 28th. Let's just say they don't go to the doctor. They don't go, it wasn't bad enough to go to the ER. So they don't go to the ER. I know, you want them to go to the ER either way, but let's just say they go. They just don't think they need it. Like, oh no, I feel okay. But then they start feeling the symptoms on like Saturday, whatever Saturday is, March something. And then they're like, oh, maybe I should call an attorney. And then they get a hold of an attorney and then you tell them, hey, go get seen straight away because your accident only happened a couple of days ago. The car's in the shop, money's tight, and maybe they might have funds for Lyft and Uber, but they're just like, hey, like I'll get to it when I can. My paycheck's going to be in a couple of days. Well, now you have a really big gap in treatment. And maybe it was a great case to begin with, but now it's not so much of a great case. And even though you're going to figure out a way to get them to treatment or figure something out, the damage is done. And there's also sometimes, like Dr. Tauber said, he's like, sometimes doctors don't tell the law firm when patients miss their appointment. They're the first ones that would know, right? It's not the law firm's appointment, it's the doctor's appointment. You can't always depend on doctors to let you know as soon as somebody's not making their appointment, right? And you don't have enough time in the day to keep on calling your clients and asking them every week or every day, like, hey, did you make your appointment? I scheduled this for you, 2 days later. Did you go? Let me know when you went. You don't have time for that either. So what can you do? What you can do, we'll get to in a little bit, but just know that it just makes sense. The fact, if you're able to make sure that if they get into an accident and they call you and they retain your services, you are able to be in a position to help them, whether it's on the pharmacy end and the transportation end. And I've talked with many attorneys who tell me this, and they say something along the lines of, I've been practicing for 25 years, or I've been a paralegal for 15 years. I've never needed this service before. So why do I need it now? Maybe you didn't need it. You may not need it. I mean, I put it this way, I gotta be devil's advocate against myself. Maybe 100% of your clients have a ride, right? And they have alternate means of transportation, and this is not an issue with the area you live in. Maybe. But I also know the main reason why you have never seen this issue is because you weren't even looking in the first place. And I don't fault you. Like if you didn't know there's a solution for this, and you weren't really focusing on this because you have so many other legal duties and functions to attend to, transportation cannot be high on your list. Pharmacy cannot be high on your list. So this is really huge right here. So now that we're hopefully at this point of this presentation, you are kind of in the boat of considering that, like, hey, this guy sounds like he's making sense, and maybe we should just make sure our clients have transportation and they have pharmacy. But what is the difference between a law firm providing the transportation and somebody else doing it? The main thing that you want to take away from this, as said out there, it's that if a law firm does it, it's a case expense. It's not recoverable, it's not compensable, and it's not included in medical damages. But if you use a medical provider, it is. That in and of itself is huge. You're not wasting your own time, spending your own staff's time and money to get these rides, to get these patients these rides anymore. A lot of law firms do that. Some law firms, they have cars. They just buy their own cars and they have people just shuttling patients all over town just to make sure they make their appointments. And that's not compensable. They just take it off the top. But if you outsource this, now you don't have to pay for your own staff time to be scheduling rides, and it can be a medical bill. And that is one of the biggest difference between a law firm continuing to schedule their rides themselves and a transportation lien provider doing it. So it's a compensable medical bill. It's just as valid as an orthopedic surgery bill or a chiropractor's bill or imaging. And I had an article written in the Daily Journal. There's attorney Matt Tauber. He's a part of Bridgewater Group in California. And we were looking at case law specific to California, but we have legal opinions in other states that just kind of talk about, hey, is it compensable in my state? And I haven't gotten through all the states yet, but literally I've done all the major states that we have to do work in. All of them have said transportation related to the injury is compensable. So that means you can't provide, like, let's just say you want to provide transportation to get them to work and back. That's not directly related to the injury. It has to be like a medical appointment or a court-related deposition or hearing. That type of stuff is compensable. And of course, you can always look at your own case. So, you know, the nuts and bolts of it are, you have three options as far as I can tell. You know, a law firm can do it. Maybe you can use pre-settlement funding, or you can just outsource this to non-recourse transportation. And there are times where I actually recommend a law firm to do it themselves. And we'll go through that a little bit later. But this is, I'll include this in the slides that we send out afterwards. But this just kind of goes to show you what are the differences between a law firm doing transportation themselves or pharmacy versus using pre-settlement funding versus using non-recourse transportation. If there is an option D, E, and F, please tell me about it because I don't know it. But from doing this for a couple of years, this is what I usually see. What is the main difference? So like I said, actually what John said even before me was this whole webinar was designed so you have actionable things you can take away, right? It's all great to talk about it in theory, but if you're not walking away saying like, hey, I learned something from this and I'm going to make a change today or tomorrow, I've not done my job. And my job is to let you guys know, like, hey, what are some things you can just do right now? Very easy. Intake smarter. And it comes down to, I have three questions or three pieces of advice or things that you can include in intake, whether you are a personal injury law firm or a personal injury healthcare provider. So on the law firm side, during case intake, ask them these questions. The fact that you're straight up asking these questions to your clients, it lets them know to think about it. Be like, hey, do I need to write? Oh, no, I'm okay. I don't need to write. And that way you guys can kind of just mentally check off, hey, we probably should not see any gap in treatment here. If they have a ride, they're going to be okay. And if they say they need a ride, or if they say, hey, I may need it, or something like that, well, you can make a note. Whatever file line case here, it doesn't really matter. Make a note somewhere where you're like, hey, either you schedule a ride for them or you use a non-recourse transportation provider or do it yourself. But you're identifying a potential gap in treatment at the very beginning. You're not waiting for that gap to occur before the damage is already done. Same thing with prescription insurance. Ask them, like, hey, if they have prescription insurance and they can afford their copays, great. One less problem for you to worry about. But if they don't have insurance and they can't afford it, or if they have insurance and they can't afford the copays, that could be a little bit of a problem. And you want to make sure that you just identify these problems in the first place. And these are, I'm sorry, John, did you want to go ahead and say something?
Hey, Ginger. Let me see if Ginger is right there, because I got a note that says we're supposed to do a break at this point. If Ginger comes on, we will. If not, then sorry for the interruption.
No problem. I got 3 slides left anyway. Do you want to just power through it?
No, you keep going. You keep going. Go ahead.
Okay, I'll power through it, guys. So on the healthcare provider side, you can ask these 3 questions. Again, this is the same slide as before. Just start thinking about what options you have. And this is actually, I'll do one more slide. This are some top reasons. As you guys read it, I'm going to tell you when I don't think you should use non-recourse transportation. So let's just say you had this case, policy limits case, and it happened in a rural area, or I'm sorry, the patient lives in a rural area, and it takes them about 45 minutes or an hour to get to a physical therapist or a chiropractor. In that case, I would probably recommend not using non-recourse transportation because over time, the round trip nature of that, combined with the frequency, the times that you have to see a chiropractor and or a physical therapist, that bill overall, it may be just as much, if not more, than a physical therapist or chiropractor service, versus if it is like closer, maybe like 30 minutes or less, that's very reasonable. If it's a far ride and it's like for a 1 or 2 time type thing, like a neurosurgeon or a specialist or a procedure, for sure you should use it. And again, you should, and if it's too far, I'd probably just recommend, hey, maybe you just eat it yourself, or maybe you recommend them to get pre-settlement funding. But the overwhelming majority of the time, a lot of your cases are going to benefit from arranging transportation, whether you do it yourself, use pre-settlement funding, or you use a non-recourse transportation provider. You know, that I'll leave that decision up to you. But the main takeaway from this presentation was raising awareness to just knowing that people are missing appointments and people are not taking their medications. And if you're able to alleviate both of those, then you're documenting pain and suffering. They are both medical damages. They're both recoverable. They're both compensable. And if you're able to outsource it, you are a legal professional. You're not a professional in transportation scheduling and making sure people take their medicine. That's not what you need to be focused on. So the more you can outsource, whether it's medical records review, whether it's, you know, imaging and you know, getting some great graphic design to help you with your case, or any of these other great consultants or these companies that help you, enable you to focus on your job better, definitely, you know, weigh it seriously and think if it's going to help you work smarter and not harder in 20 and 23. So again, thank you guys for your time. I really appreciate it. I'll get the slide deck or redacted slide deck out to you so I don't bore you with all the slides. I think I figured out which ones you guys are going to like, and I'm more than happy to entertain questions after, I guess, HMR speaks and lets us know who's going to win the coffee bean.
Perfect. Thank you so much, Dr. Patel. That was great. I wanted to give you the opportunity to kind of get through all of that good information before we brought Richard in. So that was just fantastic. And I do see that we have some questions. I'm hoping that Richard's video, we weren't sure if it was working or not, but I think we can hear you. Is that right, Richard?
Yeah, I'm assuming so. Can you guys hear me?
We sure can.
Yes.
We're sorry
Yeah,
we can't see you though today, but that's all right. We're just happy to have you with us. If you
I
don't
know,
mind, tell us a little bit about what you guys do over there, because we love working with HMR and we're very excited that you guys are coming to Nashville with us too.
Yes, we are very excited too, and I'm happy to be here. It's been a long time. I love your new hair. It's nice. I am kind of bummed that the video's not working. I spent a lot of time getting pretty for this, you know, first impressions last forever, as they say. But HMR, so yeah, what Dr. Patel was saying, we are a company that helps you focus on being a lawyer. The finances of your case can get complicated, especially if it's brain injury or there's a lot of moving pieces, or you have more than one, you know, plaintiff in the claim. So the funding that we provide, it's kind of like a one-stop shop. So our bread and butter is medical funding. We can basically help your client pay for their medical bills in 39 different states. We specialize in catastrophic injury cases. So if you have a brain injury case and it's challenging, or you don't know where to turn on how to progress your case with medical care, we can help consult with that. As Dr. Patel was saying about pre-settlement funding, we also do that. That's a very popular program. I'm actually in Northern California, so all the West Coast is my territory, and parts of Texas. And it's a very popular program because, you know, when you have someone that has a broken back, or, you know, they have a brain injury, they don't have a car more than likely, or they can't work. So we have a very competitive program that helps, you know, pay their bills and help them remove that anxiety. It's, you know, it's you got to, as I like to say, you got to pay to play. So it's one of those things where you're going to pay more if your client is stressed about their bills or can't get from point A to point B. It's going to cause you more problems. It's going to take time away from, you know, from lawyering and actually building a good case. We also do case cost funding as well. And that's a really popular program, especially here in California, because experts are, you know, they're pretty pricey, as they are around the country, but we can help pay for companies like Fox AE and, you know, nurse consultants as well. We have, I would say, the most competitive rate in the country for that as well. So all these programs tie together because we want to ensure that you have a partner on your side that understands litigation, that's been through the trenches with you guys, and helps alleviate the stress and responsibility of trying to navigate the unknowns of these cases. And we have quite a track record. You can, check the listservs, of course. You can ask your colleagues about us. We love connectionology and we also like to support our local TLAs as well. So you'll see us around. If you don't know us, you can ask about us. And of course, if you have any questions about any of these programs or how we can help you, help connect you to other medical providers, feel free to drop me a line or an email. Happy to help.
Richard, thank you. I just want to say you look better on screen today than you've ever looked before.
Thanks, John. I appreciate that. I'll make sure I'll keep this look.
Oh, okay. But look, you all have been working with us at Connectionology for several years now, just wonderfully supporting us through everything that we have done and that we have tried to do. And it has just been a wonderful relationship. And I can't thank you enough for that support and for being there for us. The other thing is, as you know, my law firm, we have worked with HMR for many, many years now. We're working on current projects, have some more coming up. You all are reliable, dependable. The cost structure is sensible. But what I love is how you all vet and assess not just the case, but a given lawyer or law firm, the client, the medical situation, so that you look at everything and try to say, okay, we can or we cannot do this. And when you say you can, you lay out a plan, and it's worked in each instance where we have worked together. And I know that across the board, people have just had overall great experiences with you all. So I can't thank you enough, and I certainly want people to make sure they're using HMR. What you all do is very special. So thank you again.
We really appreciate that, John. Thank you so much. It means a lot.
Awesome. And thank you so much, Richard, for being with us today. I made sure your information is in the chat box so everybody can stay in touch with you. And at the end of this presentation, I'll be sharing a copy of everyone's contact information, including a photo of you so they know what you look like. Okay. Thank you so much for being with us. We hope we see you very soon. Okay.
Me too. Thank you.
All right. Thanks, Richard. And then in a little bit, we're going to bring in Ted with HMR, who's going to do the coffee giveaway. But right now, I want to get to some of your questions that have come in. And John, should we go ahead and go through the ones in the Q&A box first?
Yeah, I would say go right ahead. Go.
Perfect.
You take them, Ginger.
Perfect. And Dr. Tauber, this question came in during your speech by a wonderful lady named Kathy. She wants to know, would you provide the medical article with journal reference as to 50 to 70% MVAs with some form of TBI?
Yes, I can try to get that particular one for you. That's on PubMed, and it's a consensus as well. If you look at multiple articles, it's normally in the 50 to 70% range. Let me just add that that's a good question. The other thing that maybe attorneys don't realize, sometimes clients and providers don't even realize, that the permanency of TBI is between 15, some articles, some PubMed will go as low as 5, some will go as much as 80, but the consensus is about 15 to 30% of clients or patients have permanent, and now called post-concussion syndrome symptoms as well. So I will try and find that one particular one, but there are multiple ones that have 50 to 70% in there.
Okay, perfect. Thank you so much. And again, to everybody watching, if you'd like a copy of today's slides checklist, I know both of our doctors are going to be sending me information that I can provide to all of you. So thank you for that. The next question, I believe, occurred during Dr. Patel's presentation. Do hospital health provider select medications based on cost?
I wish.
Hospital health
I wish
providers select
everyone would
medications.
take into, yeah, I wish they would take into consideration cost, but I can't blame them. There's not like some great directory, or we can, I guess GoodRx is the best directory, but it's wildly inaccurate, honestly. There's no great directory a doctor can just go to be like, hey, before I prescribe this medically appropriate medication, let me check the cost of it, because it's not on the doctor to figure out what that copay is going to be, or what the insurance status that the patient is. Some doctors, they do go that extra mile and they'll just try and work with the patient to be like, hey, is this going to be on your formulary or not? But the overwhelming majority of doctors, they don't know and they don't have time. And so there's not any great, public reference where, a doctor should or, could be looking this up. But I would say the overwhelming majority of doctors just know what a cheap generic is. And when they treat pain, like we see, I would say we have a closed list formulary, meaning we have a very big list of medications that are automatically approved because doctors tend to write for the, geographically, they tend to write the same types of medications that are not opioids, that are not controlled substances, that are just generally accepted when it comes to, MVAs, TBIs, and other, injuries where the patient has representation.
Okay, great. Thank you so much. And this might be along the same lines, but do they also moderate pricing considerations, benefits for patients?
I would say, from my experience, not really. Usually after they've written a prescription, it's they're just kind of hands off. They're like, hey, this is the medically appropriate prescription for you and your indication, because that's what they're taught in school. There's not exactly, pharmacists or PBMs or pharmacy benefit managers going around telling them, hey, if you write this medication, this is what the cost is going to be for your patient, because it's wildly different depending on which group you're with, which type of insurance plan you're on. So it's just really too hard to track. If pharmacists and pharmacy owners are having trouble with it, guaranteed the rest of the world's going to be having trouble with it as well. So I think we all just try to do the best with what we have. It's more about just realizing what you can do after like something's been written and there's going to be a problem. Having a pharmacist or having a company being able to talk to that doctor to be like, hey, you wrote something kind of expensive. We can try and see if it will be covered or it can be afforded by this case, but just in case it's not, here are some cheaper generic alternatives that would get the job done. And that's a doctor to doctor type conversation. The law firm is not involved in that, right? The law firm because then again, it could always be construed as the law firm is dictating medical care. But when you work with the right company, we're able to talk to the doctor and be like, hey, you wrote for this, can you explain why? And they're going to give a very valid recommendation as to the reason why. I'm not questioning their medical authority. They have prescriptive authority. They're the diagnosing experts. I'm the drug expert. I'm the guy who knows, what's reasonable, and we can figure out what's going to work and what's going to work great for this patient and take care of them while also respecting the limitations of the patient's, financial restrictions or case limitations.
Okay, perfect. Thank you. And then this question was sent to me. It's actually pertaining to the great transportation program that you are involved with, but how do I enroll my clients? Do you accept reductions? And then what factors should be considered when determining if they should use non-recourse transportation?
That's a loaded question. Okay, so the first part, how do you enroll? It's law firms create their free account. You just go to our website, compliantclients.com, create your law firm account. It's literally free. And you can add your own, case managers, law firm, attorneys, paralegals. You can all share the same law firm account. And once you're in there, you can enroll clients. You can enroll clients, you can request prescription cards. You can even text message the prescription card directly to your client. You can request rides there. And we don't just do like Uber and Lyft. We do wheelchair accessible. We do flights. We do, hotels. We do everything under the sun from getting your client from point A to point B and back home nationwide. We work in all 50 states. We definitely accept reductions on a case-by-case basis, because if you're in personal injury, you can't be batting 100 in all your cases. A lot of cases don't turn out the way we hoped. Sometimes things get uncovered that we were just all unexpected. We didn't really know what was going on. So yeah, absolutely, we'll work with you on a case-by-case basis. And what was the last question? I forgot.
Oh, I'll pull it up right now. The last one was, what factors should be considered when determining if we should use non-recourse transportation?
Sure, the distance of the ride and the frequency of the ride and policy limits are probably the biggest thing. Because again, the majority of the cases that you're going to get at any law firm is probably going to be, it's not going to be a slam dunk policy case every single time. It's not going to be an 18-wheeler all day long. You're going to get those fender benders. You're going to get, questionable premises liability. You're going to get dog bites and all sorts of random things. And so you have to be very conscious about case cost and medical bills. So if I were in your shoes, I would want to make sure that transportation is the lowest bill out of any other medical provider. Because even though transportation, pharmacy, or medical bills, not supposed to be bigger than a pain doctor's bill, or they're not supposed to be bigger than the totality of a chiropractor's treatment, right? So, and the best way for me to say it, you know, on a recording is, if it's more than 30 minutes one way, get a quote, right? Get a quote and see if it's going to work out for you. Because, you know, non-recourse transportation, it's not cheap, but it's also very effective, and it helps at least build your case damages, take some work off your plate. You're not the one dealing with what happens when the patient misses the ride. What happens when the things have to be rescheduled? What happens when patients aren't taking their medications? When you outsource it, it's just, you don't have to deal with it anymore, right? You're just like, hey, this is outsourced, call that number and they're going to handle it. And it's 24/7 and it's multilingual and all that sort of stuff. But if it's going to be more expensive than some other medical bills, the insurance adjuster is going to look at that and they're going to be like, why is this more expensive than this bill? Let's look into it and let's just, you know, start asking questions and, you know, really questioning the validity of the case and seeing that, you know, it's just more hassle than you have to deal with. Even though everything you're going to do is legitimate, minimizing those types of things as much as possible is great. To that end, I would love to say none of our medical bills have been ever thrown out of a patient's case. We talked to the insurance adjuster, we've been deposed, we've been subpoenaed. We come out just fine because we run a very tight ship. We're only going to provide the service when we think it's necessary and when we think it makes sense for your case, because our best interest is the same as your and your client's interest, and we want to help them on their road to recovery when it makes sense.
Absolutely. And it's such a fantastic program that you created. So I know we'll be sharing all of that information after the webinar, again, with a copy of the slides. I just got another email from our amazing Michael Maggiano, who's asking, can I get a copy of your slides? And the answer is yes. So we'll definitely send that to you guys. And I see that Ted has joined us. So let's switch over real quick. If anyone has any last minute questions, let me know. Otherwise, I'll be sharing the contact information of our doctors so you can talk to them personally later on. But Ted, excited to have you with us today. And I know you're here to share some good news because there's one lucky winner who's going to win the 4 bags of fresh coffee. And if you don't mind, who is that winner?
Yes, I'm excited to announce it's Matthew Healy out of Denver, Colorado is our big winner today. So congratulations.
Ooh, congratulations, Matthew. All right, this is our first Denver winner in a while, right, Ted?
I think so, yeah.
Fantastic. I know they are getting slammed with snow out there on the West Coast. So I think you will enjoy this coffee. And I want to thank you so much for doing this on every webinar. You've given away thousands of coffee bags. Is that right?
That's tons. I've got a whole nother order coming in. So it is good stuff.
Nice. And is there anything new coming up with HMR? Other than Nashville?
Yeah, so we've got Nashville coming up. That's all I can think of right now. I know we've got, we're in for Lanier Trial College. What is it, 7.0 this year?
Perfect.
Richard's going to be at TBI Med Legal here in a couple weeks, so we're hopping all over the country. So it's been a busy quarter, and we've still got a month left.
Well, thanks for all that you do, and thank you again for supporting us in Nashville at our TBI seminar. You're going to have a great time out there, and don't worry if you didn't win today, you guys. There's another chance to win next Tuesday because I'll be uploading all of our March webinars later this week. And you can join us for one of those. And we have some really great topics and speakers that are coming through. But again, I want to go back to Dr. Tauber, Dr. Patel, and I want to thank you both so much for being with us today. Do you have any last minute things you'd like to tell our attendees before we jump off?
Doc, you want to go?
I talk too much. I'll let you go first.
No, I just want to thank you for your interest in today's topic. And if there's anything that I can do to help you with your firm or with your providers that you work with or in any way, just let me know if there's any way that I can help, and feel free to reach out. And thanks for being here. And I appreciate the opportunity with Connectionology as well. Dr. Patel, always good to see you.
Absolutely. Thank you, Ginger, and thank you, Mr. Romano, for having me and Dr. Tauber on to help educate everybody about just some new tips and tricks that maybe you're aware of and maybe you weren't aware of. Hopefully will help you out in 2023. I would like to say Dr. Tauber and I, we're a decently wealth of knowledge outside of what we just talked about today. So whether you want to talk to us about operational efficiency, marketing tactics, you know, just being happier in the workplace. I myself, you know, I'm a partner in 6 companies, and I face a lot of similar challenges as you. Maybe they won't be strictly legal or strictly related to operating a healthcare practice, but you might be surprised to learn that a lot of the challenges that you or I face, along with every one of you, pretty similar. And so if you ever just want to just talk shop about something that you're like, hey, what do you think about this? You know, this software, this program, or how the employee culture, or just struggling with like work-life balance, you know, feel free to bounce some ideas off of me. I personally, I have a 2-year-old in some months, and I got another baby on the way in April. So I'm just trying to figure out how to make it, honestly. So just like the rest of you, I'm trying to figure out how to make it. I'm embarrassed to stand up right now because I'm in scrubs on top and shorts on the bottom. And I just came back from the pharmacy. So just being very truthful out here. So I really look forward to helping you guys in any capacity I can, because at the end of the day, I'm a pharmacist. And a lot of people come to pharmacists when they just want some trusted advice. And if it's something that's not in my wheelhouse, I'll be the first person to tell you. I don't know, but maybe I can point you in the right direction to someone who can. So once again, thank you, Ginger, Dr. Tauber, and all the sponsors that were able to make this webinar possible. I really appreciate it.
Thank you.
Absolutely. Thank you so much. And like I said, it was an honor to have you guys here with us today. We hope you'll have this or come back soon. And again, I highly suggest we'll be emailing this to everybody so you can stay in touch with our speakers, but highly suggest for you to reach out to them and stay in touch. And again, big thanks to HMR, OnPoint, and Fox AE. Again, we love working with you guys. Cannot say that enough. And it is such a pleasure to have you guys with us. So Ted, I'll see you again very soon. Dr. Tauber, Dr. Patel, thank you so much. And I hope everyone has
Ginger.
a wonderful remainder of your day.
Okay, thank you.
Thank you.
You too.
Bye, everybody. Take care.